Hi, I'm Dr. Chris. I'm a practicing chiropractor. I'm the founder of MuscleCare. I see 55,000 patient visits a year in my practice. We understand pain. If you have any friends or family that are suffering, if they're senior citizens and they want to move and feel better, please try this mini series below. It's free and it's extremely effective. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that we're warm, let's get some relief from being a senior citizen and being stiff. For the front of chest stretch, your right arm should be perpendicular, parallel to the ground, and you would actually try to hook your hand onto a wall for support. And if you can extend your fingers backward in order to open up the fascia and connective tissue of the forearm and the hand, you'll get a much better stretch all the way up the arm, all the way through the chest. But remember, what you want to do is feet are planted square on the ground, and you rotate your body away from the side you're stretching. That includes your neck. So if your right hand's on the wall, you'll turn your face and your torso to the left. Okay, do the same thing on the other side for balance. For the side of spine, make sure that you actually open up your legs. They're wider than shoulder width for stability. Put your left hand on the left side of your lateral left leg or hip. The right arm goes straight up in the air and you lean to the left side. So your right arm should be pointing to the left and it should be straight all of the time. Do both sides exactly the same. To effectively stretch the middle calf, you lean onto a wall or a post, and what you want is your left leg forward. So the left foot is pointing forward, the left knee is bent slightly, probably about 30 degrees, and then the right heel is placed back behind your body. Always keep the right heel on the ground, and then your hands are on a wall or a post, and you lean forward. And what that does, you lock your right knee out. You keep it in extension. You don't lift the heel off the ground. Your right foot must be maintained pointing forward so that we get a perfect mid-gastroc or calf stretch. And then by keeping our knee locked in extension, we stretch out all the connective tissue and the fascia behind the knee, which is where a lot of us build up a lot of tension. For an effective side of leg stretch, remember that the iliotibial band, tensor fasciae lata, very, very, very tight adhesive sort of tissue, because that stabilizes your pelvis so you don't fall over. So those stretches take a little longer and you've got to be patient. So you stand facing away from a wall, put your left hand on the wall, and what you'll do then is support yourself. Now your left foot stays planted on the ground. Your right foot crosses in front of that left leg. And then what you'll do is your right hand goes on your right hip and that pushes the hip toward the wall while you're stabilizing and holding the wall. This way you're going to be stable and you're not going to fall, but you're going to have to breathe deeply for at least 30 to 60 seconds. Notice I said 60 because fibrous tissue doesn't have a lot of blood flow. Blood flow brings magnesium into those tissues and helps them relax. So again, it's going to take longer than an average muscle. Do both sides. Now, reach around out front. Put the left hand on the back of the right one and push away from you, but do not round out. Stay straight. Open those muscles up in the upper back. Stretch them. Keep the head straight, ears over shoulder. 5 to 10 seconds. Repeat that 5 to 10 times. For the tricep stretch, it's really important that you stand with your feet shoulder width apart and you keep the ears over the shoulders, shoulders over the hip. The right arm reaches up, bends to 90 degrees over the back of the head. Still keep the head up. Many people want to drop the head forward. That's not what we want to do. Reach up with the left arm, grab the right elbow, and pull to the side, okay? Pull over to the left side. Stretch the armpit and the back of the tricep on the right side. And if you lean more to the left, you get more latissimus and tricep stretching at the same time. Make sure you do both sides. For the buttock and the lower back, lie flat on the ground, head down. Left leg stays on the ground flat, don't bend it. Lift the right knee up, reach behind the hamstring closer to the knee, and pull that knee back, because a lot of people have knee issues. So let's not squeeze the knee and grab it on top. Hold it behind, pull it to that chest on that side. The sitting hamstring stretch to start with, sit torso 90 degrees to your legs, both legs straight out in front of you. Again, and hinge at the waist and bend forward. Try to reach out to the toes. If you can't reach the toes, you can always have a small towel that you hook around the balls of the feet, hold a part of the towel in each hand, and use that for leverage to pull yourself down. Remember not to round out and strain the spine. We try to stay hinged at the waist and straight our neutral spine so we don't harm our neck or upper back. Now, if we get better at this, we can open the legs up more. So if we can take the legs out, again, to a V shape, we can actually get the inside groin or adductor muscles and the hamstrings to stretch together. The pelvic tilt is a great stretch to the lower back, but more so a little bit more of an exercise to the core. So lying flat on your back, bend the knees up, keep the feet flat on the floor, knees slightly apart, arms down by your sides, palms on the ground, and then simply lift the pelvis off the ground so you're creating a straight line between knees, thighs, and body. Hold this for 5 to 10 seconds. Again, it's a bit of a stretch, but it's more of an isometric contraction, and then relax and flatten down. As you get better at this, you can hold it for 20 seconds and up to 30 seconds. But again, a pelvic tilt is a stretch and exercise combined. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? MuscleCare is the new sub-topical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're going to love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great